How much does TB testing and treatment cost individuals? Imagine discovering you might have been exposed to tuberculosis and wondering what it could cost to find out and stay healthy. Understanding these costs is key to preventing infection and protecting your community. The expenses for TB testing and treatment can vary quite a bit depending on where you live, your insurance coverage, and the type of testing or treatment needed. Let's break it down so you know what to expect. First, testing is the initial step. The most common test is the tuberculin skin test, often called the Mantoux test. If you go to a public health clinic or local health department, the cost can be as low as $20. Private clinics might charge between $50 and $175. Blood tests, known as interferon gamma releases assays, are usually more expensive, ranging from about $150 to $350 if you don't have insurance. These tests help determine if you've been exposed to TB but don't tell if the infection is active or latent. If your test comes back positive, additional diagnostics are needed. A chest X-ray to check your lungs typically costs between $150 and $500 without insurance. Sputum tests, which examine mucus from your lungs, can cost $25 to $175. These steps help doctors decide if you have latent TB, which means the bacteria are in your body but not making you sick, or active TB, which requires more intensive treatment. Treatment costs depend on the type of TB. Latent TB usually involves taking antibiotics like isoniazid or rifampin for several months. Without insurance, a 30-tablet bottle of isoniazid might cost around $10 to $15, while rifampin could be $38 to $45. Many public health programs or clinics may provide these medications at little or no cost if you qualify. Active TB disease requires a longer course of multiple antibiotics, often lasting 6 to 12 months. The total cost for drug-susceptible TB can range from about $1,000 to $4,000, depending on the healthcare system and whether you have insurance. If the TB is resistant to drugs, treatment becomes more complex and expensive, sometimes exceeding $11,000, involving second-line medications and longer hospital stays. Beyond medications, there are other costs to consider. Doctor visits, lab tests, and imaging can add up. For example, a procedure to remove lung fluid called thoracentesis might cost between $500 and $1,500. Severe cases requiring surgery can cost $20,000 to $60,000. It's important to know that many countries and local health programs help cover these costs, especially in areas where TB is common. In the United States, public health departments often provide free or reduced-cost testing and treatment for uninsured or low-income individuals. If you're concerned about costs, it's a good idea to ask your healthcare provider about available assistance programs. Insurance plans may also cover much of the testing and treatment, but it's wise to check your coverage details beforehand. Early diagnosis and treatment not only help you stay healthy but also prevent spreading TB to others. In summary, TB testing can cost from $20 to $350 depending on the test and location. Treatment for latent TB is usually inexpensive, especially with public health support, but active TB treatment can range from $1,000 to over $10,000 if drug-resistant strains are involved. Always consult with a healthcare professional to find the best options for your situation, and remember that early testing and treatment are vital for your health and the health of your community.